There is not a day that goes by that our Bristol EMS and Police Department are not responding to overdose calls in every neighborhood, in every corner of our city. So the situation is real.
Opioid use, it's a medical diagnosis. It's a disease, and people need help. Like any other disease, they need medical attention.
This is a crisis that's affecting all families, and we just need to come up with a different way of doing business.
You can't get a job if you are facing an arrest or if you have charges. I mean, that's really hard to find someone who's willing to employ you. And so then we're just kind of perpetuating the cycle. So if we can get them early, then that's wonderful.
The actual function of COBRA is going to be for the police to have discretion to offer the alternative instead of incarceration and going through the legal process, to go to the hospital instead to seek treatment and work with the recovery experts that are in the emergency department to create a plan.
We've done specific training with our doctors and our nurses about how to quantify the withdrawal symptoms. And we know specifically what kind of blood work testing and diagnostic testing we need to perform so that there can be a warm handoff to the outpatient providers who will continue the medication-assisted therapies such as Suboxone.
We want to connect them right away to services. So we've gone to community agencies and asked for specific COBRA appointments. The crisis clinician will make that appointment for them. They'll be scheduled, and the recovery coach can even drive them to that appointment. So really trying to reduce barriers.
We're going to have a safe zone here at the Bristol Police Department, and if somebody feels that they would like some assistance, they can walk into the Bristol Police Department and they can speak with an officer, and he or she will be able to help them and will be able to facilitate getting them into the COBRA program.
We believe that the COBRA Alliance is going to be a frontline strategy for people to get the help they need, start recovery, and actually stay in recovery, which will result in a healthier community.
Bristol Hospital ER can be the front door to the recovery process. We now have the ability to really wrap every resource in the community around that patient who needs the help.
The police department wants to do everything we can to help these devastating losses that we're dealing with.
My hopes for this are that we get to reduce deaths by overdose in our city. I mean, we really are losing people at dramatic rates, and we really need to do something dramatically different to help fight this.